Appendicitis typically has two phases of symptoms. The very earliest symptoms are typically just not feeling well and having some pain in the mid portion of your abdomen around your belly button. You also may have some nausea and vomiting. If you took your temperature, you might have a very low-grade rise in your temperature, such as like 100 or 99.5. As the process progresses, the pain typically moves into the right lower quadrant of the abdomen, because as the inflammation of the appendix increases, it touches the lining of the abdominal wall in that area, which causes the pain to become localized to that spot. If you develop abdominal pain, particularly if that pain lasts several hours and then moves down to the right side, you should go be checked, either with your regular doctor, or if it's after hours or the pain is severe, to the emergency room. They may do a few tests to determine whether or not it's appendicitis. They may just examine you and say, you have appendicitis, and then they'll call the surgeons. We try to get to appendixes before they rupture, because the complication rates go up if it does. Most of the time, if the appendix is ruptured, the patient will be sicker. They may actually have less pain for a few hours after it ruptures than they did just prior to that. But they typically will develop fevers and a lot of nausea and vomiting. They may even have diarrhea, but they just get worse instead of better. If we catch it before it's ruptured, the operation is much easier and the recovery is much quicker.